Myself is Dr. Pradip Goswami. I am a consultant gynecologist and obstetrician and a subspecialist in fetal and maternal medicine. I am the founder and director of Fetamat Foundation and the lead consultant in this team. Elderly mothers means those who conceive for the first time or for the second time in the later half of their life. Roughly it is about 35 weeks onwards, As you can see, the life is changing, the lifestyle is changing. Most of the women are now making their careers, and compared to what used to be the norm 10 years before, many of the mothers have their first pregnancy after 35 years, of their life. And then with the more and more IVF pregnancies are taking place, many of the pregnant women are coming into in this group. So any age the pregnancy is possible nowadays. Therefore, it is very important to know what are the sequence or the consequences or the potential pitfalls that can be associated with the elderly mothers. The most important thing is, as the age of the mothers increases, the age of the egg also increases, So therefore, if the pregnancy takes place through their own egg, it has been seen that there are more chances of chromosomal problems, particularly the genetic problem, particularly the Down's syndrome is very, very important. There is also increased risk of miscarriages that can be associated with elderly pregnancies. So all the elderly mothers should have a very early pregnancy scan to rule out the possibility of miscarriages, maybe more than one. Then most certainly a 3 months assessment for the first trimester Down syndrome screening test or combined first trimester test done through nuchal translucency and double marker test. Then there are risks of slight more increased risk of structural abnormalities in the fetus. So a good anatomy scan at 18 to 20 weeks, a potential fetal echocardiography at 24 weeks, Then these elderly mothers are more prone to complications like blood pressure problems in pregnancy and blood sugar problems in pregnancy. They may actually be pre-gestational diabetes, That also compounds or increases the risk of problem in the pregnancy and problem in the fetus. So baby mother should be monitored for blood pressure, mother should be monitored for blood sugar as well as the fetal growth, because if there is blood sugar, baby can be bigger than normal. If the blood pressure gets higher, then the baby may fail to grow at a proper rate, So more than one fetal well-being assessment may be necessary in this group, and more intense monitoring than the standard pregnancy is needed, and therefore the role of fetal medicine is very, very important in this elderly mother group.